Happy Valentine's Day, everyone. I'm Dr. Celestin, and we are here at Celestial Plastic and Reconstructive Surgery celebrating a day that celebrates love. And how? By celebrating you. So, for the rest of the month of February into March, we are doing specials on breast augmentation. And for that reason, I wanted to talk to you a little bit about the differences between the different implant choices that you have, because it can be a little bit confusing when you're deciding what size, what fill, what texture, what shape, and what brand even. So we'll start by saying for all of the brands, I think they're all great, and really that's dealer's choice. Pictured right down here, we have an assortment of implants. Some of them are shaped, some of them are smooth and round, and this is an example of what a saline implant would look like. I keep that in the office because I like to let patients get a feel for what the different implants feel like. And yes, that is chocolate. I'll be eating it later. So for example, this is a Mentor smooth round silicone implant. This is not obviously something that would go in a patient. It's just an example or sizer. So the difference between the two of these as far as materials go is the shell is silicone in both cases, but what fills them on the inside, for this is saline and for this it's silicone gel. And in this day and age, silicone gel is a sticky substance that sticks to itself, kind of like a gummy bear. And that's why they call them gummy bear implants, because it's not liquid silicone floating around in there like it is liquid saline floating around in here. So I don't know if you can see in a video, but this is kind of one of the qualities of saline in that, okay, your implant will not have this border, but it will have this effect of when it's full, it tends to have a little bit of that ripple. And that's a concern when you're talking about a thin patient who maybe has a really thin chest wall and is very small breasted, doesn't have a lot of tissue that would be covering the implant, even under the muscle at the bottom. Saline tends to have more of a rippling effect than silicone, which, as you can see, tends to be really smooth on the edges. And the other thing is the feel. So the feel for this is a little bit more firm for a saline implant than it is for a silicone implant. A silicone implant, in my opinion, more closely mimics the feel of actual breast tissue, where it's firm but soft all at the same time. Okay, so those are the main differences between the structure of the implants. And then as far as the long-term wear between saline and silicone, they pretty much wear about the same. When a saline implant ruptures in your body, it's salt water, so it just gets reabsorbed into your system, and you notice that the implant actually goes flat because it's deflated. If you can imagine, this is water in here. I poke a hole in it, and the water is going to come out. It's salt water. It's harmless. With the silicone implant, if I cut this open, no liquid will come out, and that is because of the relationship of the shell to the gel. So if you look closely, I'm really trying here. You really cannot separate the implant from the shell. So that, the implant from the silicone. So that silicone gel is really stuck to the inside of this shell. And so if it ruptures, it really stays inside of here and it will not come leaking out. It's not a liquid form. You're not going to have a pocket in there with liquid floating around. So then you would discover that the implant is ruptured by just exam finding. Maybe it looks a little bit different because it's not as well packaged. The silicone maybe spread a little bit, so it looks a little different compared to the other side. Or a lot of the time I have patients discover it on a mammogram or an ultrasound that they were getting just for their regular health maintenance, and they happen to notice a broken implant, in which case it's not dangerous or a problem that you need to be going to the ER for. This is something that you would just then schedule your appointment, hopefully with the plastic surgeon who placed them, and make sure that everything's okay, and then they can schedule you to replace it for an elective procedure. Okay, so that's saline versus silicone. And then the next example I have here is a shaped implant. This is a Sientra brand shaped implant. And you can tell because Sientra has this white stripe on here, which is really just for us to help intraoperatively make sure that the implant is in the right orientation, because as you can imagine, unlike a round implant, there's no top, there's no bottom. For a shaped implant, there most certainly is, and you wouldn't want this in your chest in this orientation. But the main advantage of a shaped implant is that right there, that profile, where the implant maintains a little bit of a slope and mimics the shape of a breast. If you can imagine a woman's breast in profile from the side, it kind of has a gradual slope. So I really like these for a couple of things. Breast reconstruction, I think it's really nice because it does, again, mimic the shape of a breast, especially for someone who does not have breast tissue. And then for patients who are really, really concerned, maybe they really don't want to have that, they're worried about having a super round look at the top and would like more of a gradual slope, like it to sit kind of exactly the way that their breast tissue looks in the chest, then this is a great option. These are or tend to be more expensive than your typical smooth round silicone, and there is a difference in terms of the petals on them. There is a difference in terms of the actual silicone in this implant. It is a little bit more firm, a little bit more rigid, and not to say that it's not soft. It's very soft, very squishy, still feels a lot like breast tissue, but obviously, to maintain this shape, the silicone needs to be a little bit more firm than the silicone that is not in a shaped implant. So that's the real difference in them, I would say. Obviously, the shape, the price, and this is a little bit more firm. And then one small other difference is the texture of the implant. Remember, I mentioned how you want this implant to be sort of right side up. The texture helps to keep the implant in place in the pocket. A smooth surface like you have with this one is, as you can imagine, going to slide around in that pocket a lot, whereas something that's like textured is less likely to do so. It's not a guarantee. It can happen that this flips once it's been placed, but if it's been done by someone who has experience with shaped implants and sort of knows how to create those pockets to minimize movement, it's not likely. But the texture sort of helps with that, and if you feel it, it feels kind of grippy and Velcro-y to stay inside your pocket and not move. And this is an example of a shaped implant from Allergan. So that was a Sientra implant, and this is an Allergan shaped implant, just to give you an idea of, you know, the different kinds. Instead of the white stripe, this one has the two little dots. Again, that's just for us. It's like shaped implants for dummies to make sure that we don't put it in upside down. I use Keller funnels to put all of my silicone implants in because they go in full. They come out of the box with this silicone already in them. I don't put it in the OR. So as you can imagine, if you're using a 4 centimeter incision, well, this isn't going to slide in very easily, especially something that has a texture like this. So I use a Keller funnel, which is a tube of a sheet of silicone that actually helps it slide in. And this does a couple of things. Prevents me from having to make a big incision to fit this into the breast pocket. And it also diminishes how much I have to touch this implant. It's cool that I'm touching it now because this is never going to go in someone's body. But when you're putting an implant in and you want it to have longevity and minimize complications, it is best to touch it as little as possible. And the use of the Keller funnel allows me to actually not touch it in most cases. And I have a cool video of a implant going in with a Keller funnel that we'll post later, just so you have an idea of what that looks like. So I think that's about it. And I have a cool video of a implant going in with a Keller funnel that we'll post later, just so you have an idea of what that looks like. So I think that's about it. What we'll do is just leave it to you guys if you have any questions, anything that I didn't cover that's not clear, and we'll go ahead and post an answer on Insta Stories and Snapchat, Instagram, and Facebook, and keep you guys informed. Check out our specials for breast augmentation going on right now. Thank you.